I just wanted to test my audio setting. Am I audible? Dr. Sadia, can you confirm?
You are audible. Let me
Oh,
live stream the session, Dr. Bushra.
okay. We'll start on time, 9:30, but just testing before that.
Bismillahirrahmanirrahim. Hi everyone. Assalamu alaikum from Pakistan. My name is Dr. Sadia Yasin and I am founding member of medicaleducation.org, and I'm really excited to have all of you at our platform today for this webinar. And I can see that we have a diverse audience globally from different countries. Before moving formally towards this session, let me acknowledge that this session is being facilitated by BMY Health, an organization that is globally providing the facility of research mentorship, and they are upholding the vision of research integrity. In today's webinar, we are going to discuss a very trendy topic. The title of the webinar is Use of Google Trends in Health Research Publication. We shall explore that how a simple yet a very powerful tool can help us add a very new trending perspective in our health research. In this webinar, Dr. Bushra will lead us to walk through this webinar, and she will share her insight regarding the use of Google Trends in health research publication. And let me introduce our facilitator today, Dr. Bushra Anwar. She's a young and enthusiastic Canada-based physician. She is public health specialist, and she completed her research training from Aga Khan University. And after that, she got settled at Canada, and there she is currently enrolled in McMaster University and providing the services of research mentorship globally to international students. And she will share her insight regarding this session. Yeah, we shall change the screen, full screen PowerPoint after we shall start the session formally. And let me share the flow of this session. At first, Dr. Bushra will share her insight regarding using the Google Trends in health research publication. And after she's done with the presentation, we shall open the house for question answer session. You can ask question from her directly by unmuting yourself. Otherwise, you can ask the question in the chat box. And at the end of this session, we shall be having a little poll regarding your knowledge about Google Trends. And before starting this session, we shall share one poll with all of you to assess your prior knowledge about the Google Trends. So now I welcome Dr. Bushra Anwar. Madam, please share your insight about today's topic, and the floor is yours. Please start.
Thank you, Dr. Sadia, for the very kind introduction. Am I audible?
Yes, you are audible.
Okay, perfect. Thank you. So a little correction. I'm Dr. Bushra Anwar, FCPS Community Medicine from Pakistan. My learning from Aga Khan was different courses. So just to correct that, my main training is FCPS in Community Medicine from CPSP, Rawalpindi Medical University, and Health Services Academy. Now I'm learning applied clinical research from McMaster University, and also run BMY Health, which is my startup registered in Pakistan and Canada. And we are providing online training to healthcare professionals for the research capacity building. So it is my passion to make research easy, efficient, ethical, and accessible to all. For this, I have been finding ways how we can give students different tools that they can use. And many times I've seen students do not have access to hospital data. Many times we do not have real-time data, and it is actually costly to collect data. So I wanted to introduce this tool, which is Google Trends, which is a very cost-effective tool and can make your research easy. You can do this from the comfort of your desk, from your home, and you can easily publish. But as it is very easily accessible, it actually requires a lot more intelligence to use this rightly and not make any errors. And today we'll learn how we can make the effective use of this tool. right? So
Should I share first poll with them?
yes, let's start with the poll. How many of them already know Google Trends? So I do not see people answering this poll. Dr. Sadia, can you guide them where they have to poll, where they have to submit?
I'm sharing the results. Can you see the results?
No, I'm not able to. Maybe because I didn't
In the chat box?
enter my answer. Let me see.
You can't see?
No, maybe because I didn't answer the
All
poll.
right, only 16% of our participants, they know about the Google Trends. Rest 84, they don't know about the Google Trends.
All right.
So everyone is seeing, I don't know why it's not visible to you.
Okay,
Please proceed.
so that's fine. So let's start learning and discussing what is Google Trends. Google Trends, you can easily you just go to Google, write Google Trends, and it will open a portal for you. What is that actually? It is an online portal of Google which carries a lot of data related to internet searching. And it stores and analyzes more than 3 billion daily Google searches that are carried out globally. It is publicly accessible. It's something new. They have started it in 2004. Now they have a handsome amount of data of last 20 years. But still, it remains underutilized because it was not many of the researchers are aware of using this tool. It is a form of big data, and it provides insights into population behavior and health-related phenomena. And it helps to know what is the geospatial and temporal patterns related to different keyword searching on internet. So temporal means time trends, and geospatial means geographical. So we'll focus today on actually how to use this data. It is very important to understand this term, relative search volume. What is that actually? Let me first show you how the Google Trends look like. Open this portal, write something. For example, I'm writing here research. Now you see this line. What is it showing? The searching related to research is it is increasing, decreasing. It has a certain pattern. So what is this scale actually? This is what we will learn initially. This is the first concept to build on. This is actually a relative search volume. So Google does not give you the Google Trends. This portal does not give you the absolute or the real number of how many persons in thousands or millions are searching for research. It actually normalizes the data in a certain scale, and then this is presented in the form of a index. This is called relative search volume. This is actually proportion for a specific term among all the searches on Google in a given location and time, right? So this means that the proportion of searching related to research, this keyword is around 80 or 90 at this point in time in this country. And this is relative to all the other keyword searching, right? So you divide the total number of searches for a certain keyword divided by the total searches for all the other keywords in that country in that certain time period. This is relative search volume. Right, so Bilal, your question is, if we want non-relative data, I'll answer that in coming slides. So this is the main thing that you have to learn, relative search volume. Then, what else? You have got the idea that we will be getting a relative popularity of a certain keyword in that country and that time. You have the flexibility of making filters, like you can adjust the filter you want, searching trends for last 1 year. Just select past 12 months. If you want the data for past 5 years, just select this. And you can also select a custom time range. And this is the maximum data, 2004 to present. So 20 years data you can get by selecting this option. Right, so this is another filter. You can maybe keep your searching focused by adding some category like health. I want to know what is the research searching trends in health care. Right, then there are other options. You can make your searching as focused as you want, 2 different options available here. Then there is another option. You can compare the searching trends of more keywords also. And you can compare the searching in different time trends. We'll in different locations. We'll discuss these in later slides. So now what we do with this data, you can design different kinds of research studies. You can maybe simply study the time trends. Maybe you can do a cross-sectional study and compare trends in different countries. Or maybe you can do an ecological study, linking some searching trends with some disease numbers, which you can get from other sources online. So your aim of study is either you describe, you are describing the time trends or the geographical trends, or maybe you are going for finding some causal inference between some risk factor and an outcome, or maybe some searching trends with the disease numbers. So this is also possible with Google Trends. Then you can do surveillance with Google Trends. If you know that certain keywords rise or increase or decrease with health before an event occurs, you can maybe use this keyword for getting alerts for future outbreak prediction. Right, so you can keep an eye on diseases just by knowing the Google Trends data. And usually it's not, you do not use it alone, you use it in combination with other tools. But using Google Trends will actually make your surveillance cost very cost effective. So I'm going to show you some of the publications that I've seen using Google Trends. These are not all, I just added a few, just to show you what kind of studies are designed around using this tool. Association of socioeconomic and geographic factors with Google Trends for tanning and sunscreen. So they saw what is the trend for searching related to sunscreen, and then they associated it with the socioeconomic factors in US. And they observed this trend. This is the seasonal trend, how the searching increases in different seasons and decreases in others. So, and this was significantly different. This is another chart they made showing actually how the searching was related with different factors like median income, and other latitude and other factors. Then this is another study, integration of Google Trends data in predicting new HIV cases in Western, this is Philippines. Evaluating awareness of kidney disease using Google Trends. So yes, you can find awareness using Google Trends also. Sometimes it may not be possible, or you may not have enough time or manpower to carry out a whole cross-sectional study and to find the awareness for a disease. And you need some quick information. So what you can do is use Google Trends and get an idea of what is the awareness related to the disease. Then Google Trends is used for COVID-19 forecast also. And you can see how this COVID-19 deaths was actually, it was increasing with the searching. The searching was related to loss of taste. So people started searching for loss of taste on internet, and they observed that it is actually related with the rise in COVID-19 deaths. So this was helpful in COVID-19 cases forecast also, but not in all countries. In US, it was actually more useful. Because, you know, in every country, the user searching internet access, English use, it may be different. And so in some countries, this correlation will be more prominent. So you can use Google Trends, especially in these countries, for surveillance. Then this is another study predicting COVID-19 new cases in California with Google Trends and a machine learning approach. So they actually combines Google Trends and as I discussed earlier, it's not necessary that if you are introduced to this Google Trends, you start using it as a single tool for your research or for your surveillance. You can combine to make it to a better use of it, because combining it with other tools that were costly will reduce the cost, because Google Trends data will actually complement the other data. And combining some other more robust tools will help adjust some of the limitations that we have with Google Trends data. This is another study, an evaluation of internet searches as a marker of trends in population mental health. So they observed that anxiety and depression, how the trends change with different events. So people started searching more about anxiety when it was the time of elections. So this is also good for mental health research. This is another study, COVID-19 related web search behavior in Arabian Peninsula. So they are not actually correlating COVID-19 searching trends with the actual disease reports or the outbreaks. They are simply describing how was the COVID-19 related web search. So this is simple descriptive study and no correlation and no causal inference. This is another study, Sphere on the network. So yes, this is another very good use of Google Trends. Many times you see wrong information or extra hype created about diseases, and public is panic when media creates hype for certain outbreaks or diseases. Then you can monitor through Google Trends what is the trend, how much the public is panicked. And this is actually helpful for public health persons, health educators. They can keep an eye on how much is the fear related to a disease. And you will see different spellings, actually wrong spellings. And you have to, when you are using Google Trends, you have to adjust, you have to actually find all the different spellings that your population knows and uses to actually know the real fear about the disease. So this is another study. This is a paper. This is my paper, actually. I have shown here what is the trend related to research papers purchasing. Some researchers buy research papers just for reading. I think it is very, I should make it full screen. So some researchers buy research papers only for reading and to cite those in their publications, which is fine, which is ethical. Some actually buy research papers that are ready-made just to get their name in as an author, which is unethical. So I actually searched what are the trends related to both of these type of searchings, ethical and unethical. And this was the trend that I observed. This was unethical searching. Now let's learn how to access Google Trends data. We have already seen the portal and we have learned the concept of relative search volume. How is that actually analyzed by Google? As we discussed earlier, each data point is divided by the total searches of that geography in time. If I'm checking the trends of research keyword, it will give me actually a number which is the total searching for my keyword divided by the total searches for all other keywords in that country or that location and in that time period. This actually helps us in comparing different regions with different population sizes. So this is the benefit of relative search volume calculation by Google. And it is scaled from 0 to 100. This is actually, I just searched how many people are searching for family doctor in Canada in last 5 years. And it seems like the searching it has little increase over the last 5 years. I can see the breakdown in Canada, which region actually has more searches related for family doctor. So Ontario seems like having highest search for this family doctor. I can see the related queries as well to exactly know, are we actually looking for a family doctor or what? So there were different searches, residency, and finding a family doctor, finding walk-in clinics. These were the related queries. So it seems like people need doctor. Let me show you this on portal as well. Okay, so you can see here, this is the portal. Let me write family doctor. And the search is increasing. This is the last 20 years data. Let me have the last 5 years data. So if I scroll down, I'm scrolling down to see exactly the breakdown in different regions of Canada. Can you please keep your mic mute? So you can see here different provinces have different searching trends. Dr. Rafi, can you please kindly mute any participant who mistakenly puts the mic?
I have muted.
Oh, okay, thank you. So you can see the trends in different provinces of Canada here. right? Scroll down further and you will see the related queries, and this will help you understand what exactly they are actually searching. So there are different search keywords which shows actually that they need a doctor and they are finding a doctor mostly, right? So this is how we get an idea of the trends, the needs of our people in different countries. So in my country, I can see that people actually are looking for a family doctor, and this search is increasing. And this search was highest in Ontario, and in my province, it was third in the list. Then I searched actually what they are looking for, why they are looking for a family doctor. Is it because they have some acute issues or chronic health issues? So you can see here that I have used this comparison feature. So far I have only shown you searching by putting one keyword at a time. Now let me show you how we add other keywords, just to see a comparison. So I'm adding this term acute here, chronic here. And now I will get an idea of why they are looking for a family doctor. Is it more because of chronic issues or acute issues? So if family doctor search seems correlating with the other keyword search, I can assume that there may be a possibility that people are more looking for family doctor when they have some acute health issue. But I will go to acute and see the related queries also to exactly know what acute issues they are actually searching. Right, so there are different acute issues we have. And this acute seems more actually in parallel with this family doctor line. Right, so this is how we actually compare different keywords. And this picture is actually of last 1 year. On the portal, I showed you last 5 years data. So that's why the trends were a little different. Now this is another keyword that I compared for fever and flu. So which of these is more common an issue and is being searched more in Pakistan? This is actually the searching for fever, more in Sindh and KPK. And why? This is I can see the related queries to get an idea. Chikungunya fever, homeopathic medicine. So, okay, this gives you an idea that people actually go for homeopathic medicine more. This is dengue fever. This is typhoid fever. You will see very interesting and funny spellings when you use this Google Trends data. And this is actually a finding. You need to know how your people search about diseases, and this will help you in educating your patients. So this was the searching trend in Pakistan for flu, more in Balochistan at that point in time. This was actually past 30 days data, actually focused for health. And you can see the related queries, eye flu, flu shot, nasal congestion. So different issues are there linked with flu. Now let's learn how to actually store this data, download this data. So just go here, see this arrow. If you hover over this, you will see CSV written. Click on this and you get the data set. This is how you got the data set for free. No IRB approval required, no permission from Google. they have made it accessible for everyone, and you got this data set for free. And we may have many keywords, and I will show you in another slide how I actually download the data sets. But just to show you that this is the button where you download the data set. Now let me show you this video. This is a quick recap of how we access the data from Google Trends and how we store it. Meanwhile, if we have any urgent question in the chat related to the current concept that we discussed right now, I can take that. Okay, so I think these we can discuss later. Let me just run this video. This is actually the trending now. I've not clicked on the home and not one keyword search. This is trending now, which actually gives you an idea of what this country is searching for without selecting any keywords. So I was trying to find something related to health in our main topics that are trending, but I could not find, maybe I don't know French. In Canada, French and English both are in use. So then I selected Pakistan, and now you will see the trends. I just recorded this yesterday, so it will give you the trends, the latest trends. This is the trends in Pakistan, trends related to internet searching. Again, I could not find actually something related to health. Seems like people are not really searching about health as much as they are searching about other things. Then I started searching research culture, which is something I really find interesting. I keep doing research on research culture. So I observed these trends of last 5 years, how this keyword research was more popular on internet. It actually was increasing in the last 5 years, and you can see here how much is it popular in Canada, Pakistan, and other countries. Then I selected last 20 years data, and you can see this keyword is decreasing with time. Then I compared Canada research with Pakistan research. And you can see that how I change country with one keyword separately here, showing when I'm showing the comparison. So this is a focused comparison of two countries' research keyword. And you can see where in Pakistan it is more popular in KPK, and what are the related queries, and where in Canada it is more popular, what are the related queries. So if you actually read all these, you will see that Canada is more looking for jobs, research jobs. And when you see this related queries, when you read all these, you will see that Pakistan is more looking for the concepts, learning research. So this is how Google Trends actually gave me a very quick overview of the research culture of two countries. Now I can, this is just an initial idea. I will do my further research on research culture using other ideas. So now you have got the idea of how we access the Google Trends data, how we compare the searching trends in different countries and in for different keywords. We can compare the trends. You have observed these two things in related queries. Let me show you again. In related queries, you see, you click here, rising and top. What is this? Please do not write on screen. What is rising and what is top? Let's understand this. Any idea? As the name suggests, top searches mean the searches that were most popular, and rising searches mean the searches that were rising, actually. So if the searches that were rising shows actually breakout word, that means that the search was actually the growth of that keyword actually was more than 5,000%, which is very high. So they didn't then exactly give the right exact percentage. All right, so let's move on to the next thing. We have used individual keyword searching so far, as well as the comparative searching of adding more than one keyword at a time. So we need to take care of a few things here. Let me go. I'm not able to scroll up. Let me stop sharing and share again.
Dr. Usha, after stopping sharing, this problem will solve.
Okay, yes, my problem is solved. Thank you. Let me share again. All right, so we have done the individual keyword searching, right? This is the individual keyword searching. Sorry, let me remove this one. Click on the three dots and you remove it. Right now, I'm just searching one keyword. If I add more keywords here, this is comparative. What happens when I add more keywords? Did you notice a change in the line? Of course, there is. Why? When I searched family doctor individually, what Google Trends actually showed me? It was giving me the relative popularity of this keyword searching in relative to other time periods, right? At this point in time, it is less popular as compared to this point in time, right? So this number is actually the relative popularity of this keyword in normalized by time. When I add another keyword, acute, chronic, now Google Trends is giving me the popularity of family doctor searching relative to the popularity of other keyword searching in a certain time period, right? So definitely the line will change. And one of these points will be 100. Like this chronic keyword searching at this point in time was the most popular out of all these keyword searches at different times, right? So this is how the lines change, the numbers change, right? So you can see here when I'm checking the trends of research in Canada, it was more popular here at this time, November 2004. And this is the keyword in Pakistan. Research was more popular here. 100 is shown at this time, 2004. Now, when I compare both of these terms, Pakistan versus Canada research, definitely one of these points will be the most popular ones. So the research in Pakistan at in 2004 was the most popular keyword that and it was the highest search. It had the highest search volume as compared to research in Canada at any point in time. Right. So when I need to download my data sets, I will not download the data sets of comparison. I will just download the data sets individually for each keyword. If I'm going to use it for correlation studies or checking trends in time for each keyword. So just to know one thing, how to download the data set, just download it individually for each keyword, right? Instead of writing all the keywords here and then downloading the data set. So this is another example. I added 5 keywords and diphtheria was the most popular search at this time. So this is actually, these descriptions are there to guide you. Google Trends has some information there to guide, to keep your search guided. What is interest over time? It actually represents the interest relative to the highest point on the chart for the given region and time. And a value of 100 is the peak popularity for that term. And a value of 50 means that the term is half as popular. Right, so 50 does, if the number reduces from 100 to 50, it does not mean that people started reducing searching on this keyword. It may be that some other keyword searching increased. That's why this popularity was reduced. So do not assume that people are not searching for this keyword now, and because this is not popular now. It may be possible that they actually are searching for other things more as compared to this keyword, right? So there are both possibilities. And when you see the location maps, one of these will be most popular, right? Sorry, let me go to the individual keyword map. So one of these will be the most popular region, Ontario. It shows you 100. So on a scale of 100, this family doctor searching is popular here. So that means relative to other provinces, family doctor searching was most popular in Ontario, right? So interest by region is actually, it means that relative to other regions, this region had the most popular, which is showing you a number of 100. So far, we have discussed the main concepts of Google Trends, how to make the effective use, how to rightly download the data sets, how to rightly understand what is actually the numbers shown in the portal, and how to compare the regions rightly, and how to compare the time trends right. Now, somebody asked, what if we need the absolute numbers? So why do you need the absolute numbers? Sometimes we actually need it because maybe I'm correlating the numbers with the disease incidence numbers, raw numbers with the trends, where I'm not comparing any other region, but only I need data only for my country, where I actually need the absolute number. So there is an option which is actually not exactly free. This is called as Glimpse. Right here, Glimpse. and let's open this portal and you can start searching it. You have to add this as an extension to your Chrome, and it will allow you to access the absolute numbers for a keyword searching. I have recorded this actually in a video. Let me show you how you install this and how you actually access this data to find the exact absolute numbers for relative for keyword searching. Okay, now. So you have to add this extension to your Chrome. So I've just, I'm making my settings so that it gives me the access to portal. So you can turn on here and you have the option of getting 10 keyword searching in 1 month. If you want more, you have to pay this. So this glimpse is free, you have free credits for a month, only 10 credits. You can see here that I've selected this keyword research here to find the exact numbers, and this was actually the number, and it also showed me the seasonality and the reason of why the seasonal changes were there. Sorry, this keyword is not research, this is safe plastics. Because I was interested in doing a survey on how many people in Canada are actually aware of and actually cautious to use safe plastics. So I just did a quick research on this using this data. And I found that most of them are using Instagram. If you have actually taken notice of this thing, you can see here which channel is actually giving you the most data. And so Instagram was the most popular channel where they were trying to search for safe plastics. And this is actually worldwide trend. I then focused my searching on Canada after that. So here you can select absolute and relative numbers. The benefit of relative is that it actually allows you to compare different countries because it adjusts the numbers with the different population sizes of different countries. But the absolute numbers will actually tell you the exact number of how many people were searching for this thing. Right, so this is how we access Glimpse. And this was the relative queries. Right? So this was all about Glimpse. Now, in our last few minutes, we will discuss the limitations and strengths. So you have seen that how easy it was to access the Google Trends data, the Glimpse data, and how easily in such a short time we can get quick insights into population health, their behaviors. But you have to understand a few limitations that are there with Google Trends data. we do not understand actually why the user was using this keyword in internet searching. Sometimes we start relating the trends of a symptom searching for a disease, and we start correlating it with the disease incidence and outbreaks prediction. But we do not know if the person was doing this search on internet because they had the disease, they were developing the symptoms, or just because they wanted, they were studying it and were getting educated about that, right? So you do not know the exact intent and the user characteristics. Then Google Trends data is actually more useful for researches that are done in areas where there is good internet access and English is used. You can add in your keywords other language words also. I simply translated some of my words in Urdu using the word feature of translate. Like here, I added some keywords and okay, it's not at the moment, it's not here, but I used word feature of translating words and then copy pasted those in the Google Trends portal, and it gave me the data for those keyword search also. But mostly it will be beneficial for those areas where people use more English and where there is good access of internet and where there is good literacy levels. Then you have to understand that different spellings may be used by different people. So if you just analyze the data with right spellings, then it may not give you the best results. Then in China, there is limited applicability because of limited Google service. Besides all these limitations, there are still many strengths. It is the easily accessible tool and it is free, but there are some other benefits also. And one is that it gives you the related queries and topics. How it helps us is it actually gives us insights into what people are actually searching related to particular disease. It can help us pick some myths related to a disease. Maybe those keywords are available in the related queries. Some myths and misperceptions about the diseases can be easily picked here, right? So then the benefit of Google Trends is that Google is actually the most popular global search engine, more than others, more than Bing, Yahoo. And this is why the Google Trends data will actually give you reliable data because it is being used by majority. Then it is also strongly beneficial in sensitive health topics where you avoid, where you are limited for doing surveys because these topics are really sensitive and you have to take care of the data anonymity and people are not really open and not ready to give you data easily for these. So these topics like AIDS, mental disorders, suicide, and illegal drugs. So for these kind of studies, this actually is very beneficial. So another thing is that there are no proper guidelines and agreed standards so far related to Google Trends publications. And this is something that we can work on. And if you want some quick reference document, this is one I'm showing the link here. Let me paste this in chat. So this is a very good document if you want to know how to rightly publish these papers using Google Trends data. Just go to these tables and it will give you, a very good summary of how to search. You can, just like you use Boolean operators in PubMed searching, there are some tricks here also, adding plus and minus. If you want some keyword to be not there in the data, in the results, just add a minus sign. For example, I want family data, but not doctor. This will give me data about family, but not doctor. So let me zoom this to rightly show you. A minus sign separating two words limits the results to searches containing the first word, but excludes searches with the second word. Right, so we choose these signs when we want our search to be more focused. We can use the plus sign, which is equal to the or Boolean operator in PubMed searching. Right, so just access this this paper, and you will see this table, which is giving you a very detailed guidance on how to rightly access this data and how to rightly publish this. What are the reporting guidelines? They have mentioned the reporting guidelines that their team has suggested. So far, no other official guidelines are available. Right, so the best thing that they suggest, which I strongly feel now, is that you always report when you had actually accessed the data. Because sometimes Google Trends changes their way of analyzing the data, their algorithms, and so this is why the date of accessing the data is very important. Then it's good to actually take the screenshots of your searching and make this raw data available online, maybe as a supplementary document with your publication. Right, so there are many researchers now who are trying to evolve this, making new methods, combining Google Trends with other things to make more effective use of this tool. And WHO also recommends this actually. Who is actually using it? It's still not a very known tool, but we have seen that the publications are rising. There's a 7 times increase from 2009 to 2013. The median citation rate is 7 per article, which is good enough as compared to other scientific article citations, which is 7.64. It is more commonly used in infectious diseases, mental health, NCDs, and general population behavior. And the validity was actually high among surveillance studies. 92% were validated against a reference standard data source. And 80% of studies using correlation had a high correlation statistic, more than 0.7. So this seems like it was actually reliable, but we have to carefully use it, not for every disease, but see which of the diseases seem like correlated with the trends data. The best example was of influenza epidemic. In influenza epidemic, actually, Google Trends data was really helpful in predicting the disease outbreak with a 1-day reporting lag. While the CDC could predict with a 1 to 2 weeks reporting lag, the Trends data only had a 1-day reporting lag. So this was really helpful in predicting influenza epidemics. And they had made this separate portal for Google Flu Trends. But this was discontinued later on because once this trends data actually overestimated in predicting the outbreak. So then they discontinued. But the right way of using Google Trends is that do not use it alone for predicting diseases. Combine it with other tools. If the searching is increasing for a disease, then there is a high chance that it is increasing because people are having symptoms, and you can think that, okay, some outbreak is going to happen. But there is a chance that there is also a chance that people are searching more for it because of some media campaigns. Maybe the media is creating hype for something, and this is why people have started searching for this disease. So at that time, when Google Trends actually overestimated in predicting the outbreak, there was some media campaign. WHO is actually, it recommends that we understand community concerns and questions. It actually encourages focusing on this science of studying what is the information there available, what information is there regarding people searching about diseases, because they say that many times the health authorities that are trying to help to educate public about a disease, the wrong information on internet actually it does the opposite of that, and the wrong information which spreads actually undermines all the efforts of public health agencies and the physicians. So they actually encourage keeping an eye on these community questions, searching, and concerns. And this is called infodemiology, which is actually too much information, including false or misleading information in digital platforms. And the study of this information is infodemiology, the science of distribution and determinants of information in an electronic medium, specifically the internet. It is actually infodemiology, and the benefit of studying this science is to inform public health and public policy. So this is something which is taking now more popularity. People are exploring this because now we have got a 20 years good data available to us, and it has been seen as something reliable and efficient. So now it's good time to focus on this and make use of this tool. I have added some videos also for how we actually analyze the data in using this Google Trends datasets. And you can, I will share the link in the chat. Just take one link and you can access the other videos in that channel. Okay. This is the way forward. We need to do more studies with this tool to help develop this infodemiology science and to find how reliable is this in predicting other diseases. And we suggest that Google should collaborate with researchers to further evolve this tool. These are some of the references, and this was all about today's discussion is complete. Now I'm open to any questions and comments and feedback. I hope this was clear, Dr. Sadia.
Thank you so much for such an insightful session. In a very simple
you.
way, you have elaborated about the Google Trends, that how they can shape the research perspective, especially regarding the public health and health research. So now the floor is open, the house is open for question answer session. I would like the participants to ask question, put their queries in chat box, as well as you can ask your questions directly from Dr. Bushra by unmuting yourself from mic. So first of all, I shall read all of the queries you have penned down in chat box, and then I shall invite all of you for one-to-one question answer. So should we start, Dr. Bushra?
Yes.
So the first question is, Madam, if we need non-relative data, then?
Yes, we have discussed this. Glimpse is actually the answer. We find absolute numbers using the Glimpse tool that I've shown.
Yeah, that's right. Other question is, how much Google Trends-based studies are worthy? Like, are they of comparable value of cross-sectional or review studies?
Well, this is also answered in my latest slides. Let me go back to that again. So the citation rate of 7 means that it was actually it was found as valuable by the journals. And I have opened one article with me. You can see this was published in a good journal. And this is just one article because I was following this for a publication, a similar topic. And you can just do a quick review of the articles that are published using Google Trends, and you will see I have shown you many publications, and these are in good journals.
All
Every
right.
tool has its different value. Cross-sectional study has a different value. Definitely, we need all the study, all the tools and all the study designs. It just depends on your resources, how much you are ready to invest in a research, and you can select your tool and study design accordingly.
Exactly.
And you can combine this tool with other tools. Maybe you can do a cross-sectional survey on awareness related to something and also add some information from Google Trends.
So next question is, Madam, how can we know that words is highest search in an area? I think you have discussed this question as well.
Yes.
So for article beside trends, we need actual value, like in COVID, number of cases increase from uh, dash to dash. How can we get? I think you have told them in glimpse trends, the absolute value.
Yes, the absolute numbers in, yes, we access
Okay.
that
How
using.
the reliability of search data can be found?
You can definitely see if it is correlating with the disease incidence rates or not. And if it is not correlating, then it's okay. Just publish that. I have recorded some videos that for which I have given you the link. And in those videos, I've actually used keywords that I was trying to find if they can predict the diphtheria outbreak and their rise with the diphtheria uh, cases or not. So they were not actually very much correlating, but that's fine. If I can even publish this result, this is a finding that for this particular disease, these keywords do not help in predicting.
All right. Sitra Ahmed is, I think she is saying that, okay, so no IRB needed.
Yes, that's the good
Can
thing.
can I add one perspective on my side regarding the IRB?
Yes.
Sidra, we don't need IRB for already available data, internet data for the use of their data. We just need to access the data site. We can request them for the data access, but we don't need IRB approval, as well as we don't need IRB approval for systematic reviews, narrative review articles, and to some extent in educational researches, when there is some until unless there is no sensitive information is involved, you don't need IRB, but some journals even ask about the ethical approval even for the educational researches. So that's my perspective regarding ethical approval requirement. So next question is, what is the response of journals to such studies? We have discussed this, I think.
Yes, yes, we have discussed many of the things.
So,
IRB is the real pain, I understand. For many students and doctors, they have real issues with getting approval for their research.
yeah,
So if you do not have time or resources or access to data, then you can use this tool.
actually, this is least focused niche in our country. That how can we simplify and make the process of ethical approval easy for the
Yes.
participants if they want to conduct a research. So next question
Yes,
is,
yes, exactly.
can we have a summary of key points?
Summary of key points. You can, if maybe you can, if somebody has summarized, they can share the notes. Are you talking about the whole slides?
I have meeting summary. I can share my email address if you want to have that summary. I will
Any
share.
plagiarism issue, Dr. Tahil? No, there is nothing about plagiarism here. Okay, somebody asked, okay, how do you compare CTC Wonder data with data from Google Trends? So, see, Google Trends is data for internet searching, and these other sources like CDC, WHO, I have used this. I have combined this data to correlate with searching trends. In the videos that I have shared, the link that I have shared, you will see how I find correlation between the searching data and the disease numbers. So the disease numbers I get from these sites, WHO or CDC or other sites, right? So that data is about disease and other things. And it's
So they
Google Trends, it's different data. It doesn't
perfect.
give you the disease numbers or prevalence or incidence.
Perfect. So there are some morale boosting comments. We should share those comments as well. Dr. Bushra, as expected, an excellent session, wonderful presentation, Dr. Bushra. Mr.
Thank
Bas
you.
is saying, thank you, ma'am. It was really helpful. Wali Muhammad is saying, thank you so much, Dr. Bushra, as always, for such a great session. Shafi Armagan, excellent presentation. Hafsa Fahad. So for comparison, yeah, I think you have catered this query. How do you compare CDC Wonder data with data from Google Trends? Okay, fine. Can we use the data further as a whole research? Means the way we do for other research types, for example, writing manuscript from it. I mean, is this the same as we collect data from questionnaire?
Questionnaire data, that is primary research, and it is definitely you are not collecting data about internet searching, right? So that is something else.
Basically, this is secondary data.
The Google Trends data is data about internet searching. How many people are doing search for this topic, this disease? So Google Trends data is not disease numbers. It is not my answer to something. Questionnaires, we throw questionnaires to get your answers for something. So that is quite a different thing. And we do not give questionnaires to people to ask them, please tell me how much searching do you do for this keyword. So that is actually a different thing.
All right.
It depends on what your research question is.
Yeah. Next question is, in countries where use of Google search is not as much as countries like US, how to interpret Google Trends or generalize the results?
So Google Trends actually, it does not include the data for some keywords that were not enough searched in a country. So it will give you blank rows. when you download the data sets of geographical regions that I showed in my presentation, how you actually download that. So you will see in Excel sheet that some of the rows will be empty for some of the countries. And that is because of very low searching in that country, and it will come empty. So you will not actually include in that data in your analysis and retain only those countries for which data is provided by Google.
All right.
Right, so Google will only provide the data if enough searching was done in that country for that keyword.
Perfect. So now I would like to invite all of the participants who want to ask the direct question from Dr. Bushra. You can raise your hand and unmute yourself and ask the question. Do you have any question?
Thank you, Dr. Wajahat, for the appreciation. Yes, it was a
Thank-
great collaboration.
Thank
I
you so
think
much.
all have shared their queries in the chat. Thank you so much for these
All right,
comments.
Dr. Bushra, let me connect with Dr. Rafi. Dr. Rafi, do you have some question in our live session from YouTube?
Yes, ma'am, we had questions on YouTube, but all have been answered.
All right, all right. So, concluding this session, I'm really grateful, Dr. Bushra, for such an enlightening and insightful session. I hope all of the participants have learned a lot new things, and I'm really grateful to all of those participants who are still there till the end of the hour. And your dedication, your motivation, your active participation, basically all these things that boost up the morale of a facilitator as well as the organization. So happy learning, stay blessed, and take a lot of care. Allah Hafiz, everyone. Allah Hafiz,
Thank you
Dr.
so
Bushra.
much. Thank
Thank
you,
you so
Allah.
much.